Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give me the valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order, and I hope this will be very convenient for the continuous study. My dear friends, today we shall discuss about dengue fever. Now, dengue fever is very common in the present day scenario, and discussion on the dengue fever is also important for undergraduate students, postgraduate students, and also for the practitioners. Of course, for the undergraduate student, this most detailed explanation may not be required, but definitely for the postgraduates and as well as practitioners, this video will going to help. Undergraduate students may only take the basics. Talking about the dengue fever. Dengue fever is also called as break bone fever. The reason why it is called as break bone fever is this is a fever which is associated with the intolerable muscle pain and joint pain. That means myalgia is one of the main symptoms. Patient will have intolerable body aches and body pains. Therefore, this fever is also called as break bone fever. Now, we know that this fever is basically the dengue virus. The causative factor is the dengue virus, and this dengue virus will going to spread through a mosquito which is belonging to Aedes aegypti type. Okay, so mosquito name is Aedes aegypti. Everybody I think knows this, and this is a mosquito borne disease in the tropical areas or tropical disease, basically caused by the dengue virus. Now, presently, no vaccine is available for the prevention of the dengue, and therefore we have been giving more focus on mosquito control, that is controlling the habitat of the mosquito and taking the precautionary steps. Now, 80% of the dengue viral infections are asymptomatic. That means dengue virus caused the fever. It is almost all similar to the other types of the viral infections most of the time and remain asymptomatic. It remains asymptomatic with mild symptoms such as uncomplicated fever. Just like the other simple viral infections, even the dengue viral infection also have the mild symptoms with the fever and some cough, cold, etc. in 80% of the cases. But why this dengue fever is dangerous? Because the rest of the 20% is quite dangerous, because dengue fever may cause some of the complication in rest of the 20% of the cases. The two important complication is hemorrhage, that is bleeding and hemorrhage, and as well as shock, that we will discuss later. Therefore, because of this hemorrhage and shock as a complication of this dengue fever, this dengue fever is now proved to be fatal. Now, incubation period of the dengue fever is about dengue virus is about 3 to 14 days, but average if you take almost all 4 to 7 days you can take in the present scenario. Now, one more important nature of this fever is this is a biphasic fever. Biphasic fever, or it is also called as saddleback. I think in the camels and all there will be a saddleback, isn't it? Just like here in this fever also, it is called as biphasic or saddleback. What is the meaning of it? Relapse with the reoccurrence after 2 days. That means initially when the fever starts, you will have a course of the fever for 3 or 4 days. Then the fever stops. Then after 3 or 4 days, again fever rises. Fever rises dangerously with all the complications. So this is called as biphasic nature of the dengue virus. Therefore, it is also called as saddleback fever. This is also called as saddleback fever or biphasic fever. Mostly in almost all the virus, we will have this biphasic nature. But the difference is in all the other virus, the first phase is very dangerous. Dangerous means very acute and sudden rise of temperature will be there. And then the fever comes down, and when fever is about to leave you, at that time again there is a slight rise in the temperature, and then the fever finishes, decreases. This is a normal course in other viruses. But in case of dengue virus, the course is same, but the effect is different. That means in the first phase, the fever is not much acute or rapid or more severe. In the second course, which is supposed to be very, very small and less effective in other viruses, here that second phase is more dangerous. Okay, that we'll discuss. Therefore, it is called as biphasic. Instead of first phase being more dangerous, the second phase is more dangerous in case of dengue fever. So such viruses are called as biphasic virus. Okay, biphasic nature of the virus, or such viruses are called as biphasic viruses. So that is seen in case of dengue fever. Therefore, it is called as a biphasic fever, or it is also called as saddleback fever. Just in the camel and all seating arrangement is there. So there is a small rise followed by a sudden rise, big rise. So when you talk about dengue fever, three possibilities are there. One is dengue fever may be very simple fever with the minimum symptoms or asymptomatic without any complications. Okay, most of the time 80% of the fever 50 to 80% of the fever what we encounter are related to dengue. So they are of this particular nature. Second type is dengue with hemorrhagic fever. Dengue fever causing hemorrhage, and therefore it is causing so many complications. And third one is dengue shock syndrome. That means after the hemorrhage, there is a lot of fluid loss will be there, and that leads to shock, that leads to decreased circulation to the vital organs of the body, and that leads to dengue shock syndrome. So these are the three phases, you can say, or three important facets of this particular dengue fever. Okay, in 50 to 80% of the cases, dengue fever is totally asymptomatic and uncomplicated and not dangerous. But in that 20% of the cases, there is every chance of dengue hemorrhagic fever and dengue shock syndrome. Most of the time, out of this 20%, 5% of the patients will go for the dengue shock syndrome. Now we need to know that the dengue fever patients, just I told now, 50% will be symptomatic and rest of the 50% are, that means they are less complication. Out of which only 10% will develop the dengue hemorrhagic fever. Okay, and out of which only 1% will develop the dengue shock syndrome. Okay, if the 50% symptomatic if you take, then 10% will develop dengue hemorrhagic fever, and only 1% will develop a dengue shock syndrome. This is a rough estimation. Okay, so what we are actually bothered is about the 10% of the symptomatic patients only. So therefore, whenever dengue is positive, no need to be panic at once as far as patient is concerned, because only out of that 50 to 80%, only 10% will develop the dengue hemorrhage fever, and out of that 10%, only 1% will go into develop dengue hemorrhagic shock syndrome. So anyway, this basic should be there. Now dengue fever, a patient who is living in the endemic area, or if he is traveling to that particular endemic area to the dengue, may be the victim. And most of the time when in dengue fever the fever comes, the two following criteria will be there: whether that fever is there with the nausea, rash, body aches. Okay, these are the three important criteria. Suppose usually most of the viral infections what we'll have, so they will start with the upper respiratory tract infection, cough, cold, etc. will be the most common symptom. But along with that cough, cold and etc. may present or may not present, if the nausea, rashes and body ache, if this is more predominant, then it gives a suspicion towards the dengue fever. Okay, now about the rash, talking about the rash, one of the very important thing which helps to identify the dengue at the earliest is a tourniquet test. Tourniquet test is very simple. Tourniquet test is done to identify the rashes, because dengue virus is known to cause the bleeding. That is the main problem. Okay, many viruses are not so dangerous because they will not cause any such fatal complications. But one of the nature of the dengue virus is it damages capillary endothelium. It damages the capillary endothelium. Once the capillary endothelium get damaged, so there is oozing of the blood outside, and that leads to bleeding. Okay, that leads to bleeding. So therefore, because of this bleeding, so many complications will come. The pathophysiology we will see later. Now, therefore, tourniquet test is quite useful to identify whether the bleeding is there or not. What you have to do? You just inflate the BP cuff in between the systolic and diastolic BP. Okay, maybe inflate it and keep it at around 100 mm of Hg. Then mark 1 square inch area in the forearm. Okay, and watch it. Clean it and watch it. Okay, make a area in the forearm and clean it and watch it. If there is any pinpoint hemorrhages, that means when you inflate the BP cuff and keep it in the 100 only, okay, in that particular condition, in the already identified area, if there is development of any pinpoint hemorrhages or bleeding spots, small bleeding spots like petechiae, okay, and if that petechiae is more than 10, okay, so more than 10, so then it is called as positive tourniquet test. Okay, so you have to suspect about probably there is dengue. And if that pinpoint hemorrhages occurring in 1 square meter area, if it is more than 20, then definitely the hemorrhage has begun, bleeding has started. So tourniquet test is quite useful to identify the dengue fever at the earliest, and also to identify the complications of dengue fever at the earliest and take appropriate steps. Very simple test that you can do in the OPD level. Now leukopenia will be also there. One more criteria in the dengue fever is leukopenia will be also there. Now leukopenia, that means reduced amount of the WBC, because dengue fever, dengue virus, that is very virulent. The virulence nature of the dengue virus is more, and as a result it also causes immunosuppression, and because of this immunosuppression also many times you will find leukopenia. One more thing is, if the bleeding is taking place, so when the blood is going out of the capillaries into the extracellular space, that time along with the protein, along with the serum plasma, so many proteins, WBC, RBC can also go out. That may also lead to leukopenia. That leukopenia in the later phase of the part. But if the patient has started the fever just 1 or 2 days and he has got no leukopenia on CBC, suppose, so that suggested it is not because of leaking and all. It is, and patient is not having any complications, but still leukopenia is there in the CBC. So that is because of the virulence nature of the virus, which is causing immunosuppression. Therefore leukopenia will be there. So this leukopenia has got two way of interpretation. If it is occurring in the later phase, okay, in the critical phase, what we say critical phase, it has got other interpretation. But if it is occurring in the first phase, okay, then it has got other interpretation. Now thing is when to suspect the dengue fever. So when you suspect the fever with the dengue in a child, suspect if any 2 or 3 of the below points are there or symptoms are there along with the fever. Yes, fever will be there along with the fever. If the child is having some other points also, other symptoms also, then you have to suspect about the fever. Okay, number 1 is headache. Yes, headache is there. Then retroorbital pain. This is very typical. Retroorbital pain behind the ears. Usually in most of the fevers you don't have this particular symptom, isn't it? Even in viral fevers also we don't have any headache also, except some of the fevers. Okay, headache, then retroorbital pain behind the ears. Then comes lethargy. Lethargy is very maximum because it's affecting the capillaries. Okay, capillary endothelium get affected. So some bleeding is taking place. Capillary endothelium is very important for so many other metabolic activities and many things also. Okay, so therefore lethargy will be there. Then thrombocytopenia of less than 1.5 lakhs. Thrombocytopenia of less than 1.5 lakhs. That means platelet count, if it is fallen below 1.5 lakhs, from the 5 lakhs, if it is coming up to 1.5 lakhs, that is thrombocytopenia is there. Platelet is decreasing. So this is also very significant. Now one thing we have to make clear that in case of dengue fever, platelet count will going to decrease. This decrease because of the 2 important things. Number 1, dengue virus will produce some antibodies against the platelet which kills the platelet, and as a result the platelet count comes down. Second is, once the capillary leakage takes place, capillary damage takes place, then blood along with the, that is plasma along with some of the cells, it will go out of the vessel into the extracellular space. So when it is going out, WBC, platelets, RBC, everything goes out. That also decreases the platelet count. Now, that also decreases the platelet count. Therefore, platelet count is decreasing without any symptoms. That means major symptoms. And platelet count is decreasing along with the complicated symptoms, complications. Now both have got different interpretations. We have to be very, very careful. Okay. Third possibility is in almost all the viral infections also, sometimes there will be a decrease in the platelet count, because just like dengue virus, so many other viruses also produce an antibody against the platelets. Okay, so that may decrease the platelet count. So simply the platelet count estimation is not a criteria to say that patient is having dengue fever. Okay, so thrombocytopenia of less than 1.5 lakhs, and then arthralgia and myalgia. I already told in the beginning, body pain, intolerable body pain, joint pain, muscle pain, etc. Okay, then rash. So this rash is nothing but rash is developed because of the bleeding. Petechiae. So pinpoint hemorrhages are developing from the skin and the mucous membrane. So that is also very, very typical. Then comes bleeding manifestations. If the patient has got bleeding manifestations, including the positive tourniquet test. And if the TC, total count is less than 5,000, leukopenia, that is leukopenia if it is there. Then raising hematocrit by more than 10 to 15%. Now this is also very, very important. Now if the capillary leakage has been taken place, first was in the first phase, what happens? The plasma will go out. Then along with the plasma, the cells which are present in the blood will also goes out. Cells which are present in the blood is just like a RBC, WBC, platelets, etc. Now when RBC goes out from the blood into the extracellular space, in the vascular space, the amount of the RBC will going to decrease. Okay, so when amount of the RBC will going to decrease, if you go for packed cell volume or if you go for hematocrit value, then the hematocrit value will going to rise, because most of the RBC is going out of the blood. So normally what happens, hematocrit value will, hematocrit value, packed cell volume will going to decrease, and that result in, that means the RBC number is going to decrease. So this result in increased hematocrit value by 10 to 15%. So therefore, more than platelets, in case of dengue, always to assess the complications, it is raising hematocrit value is more important. Okay, that means if the hematocrit value is daily increasing, that suggests that daily RBC is going out of the blood. That means the leakage, capillary leakage is more. This dengue fever is also called as capillary leakage syndrome. Okay, this is one of the cause of capillary leakage syndrome. So these are the important points that you have to suspect for dengue fever. Okay, child is having fever, but along with the fever, if the child has got headache, retroorbital pain, lethargy, intolerable body pain, thrombocytopenia, raising hematocrit, leukopenia, bleeding manifestations, positive tourniquet test. Okay, so these are all the things which helps to give a clue that this particular problem may be a dengue fever. Now looking at the pathophysiology of dengue fever. Pathophysiology of the dengue fever, what actually happens is there will be capillary endothelial damage. As I explained earlier, there will be capillary endothelial damage, and what leaks out is not just water, it is plasma which contains so many proteins. Okay, so this is, see, basic pathology of the dengue fever is this: dengue virus will going to cause capillary endothelial damage. Because of this capillary endothelial damage, plasma goes out along with so many proteins. When it is more pronounced, the blood contents also start going out of the capillary into the extracellular space. Okay, now what happens? The vascular space is almost all empty. Okay, there is no fluid for the circulation, no blood for the circulation. Then the vital organs will go into suffer, and that's the reason why it leads to dengue hemorrhagic fever and dengue hemorrhagic shock. Now kidney is not receiving proper good amount of the circulation. Heart is not receiving the blood because all the fluid is now out of the vascular area because of the capillary leakage. Okay, so this is the main thing which causes the pathology. So dengue is either because there is a direct invasion of the, why this capillary endothelium damage takes place. The test says that there may be direct invasion of the virus into the capillary. Many times the virus directly goes to the capillaries and damage it, number one. Or sometimes some of the cytokines, chemical substances are which are produced in response to dengue fever. So when dengue fever is there, body immune system get activated and it produces some cytokines. Sometimes these cytokines may go and damage the capillary endothelium also. And sometimes there is a production of an antibody which is produced against the virus by the body, and it may cause an antigen antibody reaction. This antigen antibody complex will go and deposit over the endothelium of the capillary and damage it and may lead to bleeding. See, these are all the possibilities why there is capillary leak or capillary damage in case of a dengue fever. Therefore, all the above three will going to cause the capillary leak, and as a result we can witness many complications of a dengue fever. All the complications starting from headache, then the edemas, so they are all because of capillary leak, shock, etc. Now clinically this manifests as either pleural effusion. Now when the fluid is going out of the vessel into the extracellular space, what actually happens is clinically that fluid will get accumulated in the third space. Third space means third space fluids. That means the pleura, then pericardium, then peritoneum, then orbital surface. So, okay, these are all the third space. Okay, here when the fluid start accumulates in third space, like pleural effusion, peritonitis or ascites, then in the orbital area. In the orbital area, when the fluid accumulates, it leads to periorbital pain or retroorbital pain, retroorbital pain, and there will be edema all over the body. The edema may be in the pleura, or it may be in the peritoneum, it may be in the pericardium, it may be in the intestine. Okay, anywhere the edema starts because whatever the fluid which is present in the vascular space is now coming outside. Okay, so when babies with the intestinal edema are there, it is quite dangerous for the newborns or babies. Babies with the intestinal edema, it is always dangerous. When this baby recovers, they look very thin and almost unrecognizable with their previous part. What actually happens is when the GIT is under the pressure of the edema, GIT is not able to do the normal functions. Okay, digestion and metabolism. So therefore, the child will nutritionally get deprived and child will be very weak at the end. Okay, so this should not be taken lightly. Therefore, this should not be taken lightly because it is the only skin affected. Every organ of the body is edematous. So that means जो bleeding चल रहा है वो कहीं से भी हो सकता है ना, कि maybe almost all the capillaries in the body are get that means maximum capillaries are get affected and maximum leak is taking place from intestine, maybe from the brain, maybe from the lungs or anywhere the capillaries are there, so the capillaries get damaged. Okay, and as a result there will be flow of the blood and the plasma to outside from the vessel. So blood finds difficult to enter inside the organ and organs suffer with the organs suffer with the nutritional deficit. Now just imagine the amount of the blood which is going to the each and every organ is now limited, okay, or reduced. Then definitely nutritionally they get affected. As far as oxygen supply is considered, they are get affected. As far as removal of the waste product is considered, that will be get affected. So therefore it leads to dengue hemorrhagic shock. Okay, so anyway, this is the total pathophysiology. The warning signs, again we are repeating in the OPD level. When you are sitting, a patient comes, the warning signs are abdominal pain and tenderness, bleeding manifestations, fluid accumulations in the body, lethargy, persistent vomiting, hepatomegaly, and in the lab report 2 is very important. More than platelets, what is important is increased hematocrit value, and decreased platelets. These are the two important things which has to be seen laboratory wise. Now in the next class we shall see the course of the dengue fever, how the dengue fever goes, how it proceeds, what do you mean by the febrile phase, what do you mean by the critical phase, and what do you mean by the recovery phase. So that we'll going to discuss in the next class.